Did you know men who eat more cooked tomatoes may reduce their risk of prostate cancer by up to 35%? That's not a myth, it's published data. And it all starts with what's on your plate. I'm Dr. Max, urologist and men's health expert. Today we're answering a big question I hear all the time. Can food really improve your prostate health? The answer? Yes, if you know what to eat and why it matters. I'm a firm believer. Health starts in the kitchen. I meet men daily who are frustrated with medications, nighttime trips to the bathroom, or just worrying about their prostate. Rarely do they know that what they eat, what's on their fork, could be part of the solution. That's what we're fixing today. By age 60, more than 50% of men will experience urinary symptoms, waking up at night, weak stream, sudden urgency. But here's what most don't realize. These symptoms often don't begin with the prostate itself. They start silently, years earlier, fueled by chronic low-grade inflammation, hormonal shifts, and yes, diet. Yet, what do most men hear when they go to the doctor? Take this pill. Maybe surgery down the line. We're trained to fight symptoms, not prevent them. And it's not your fault. Traditional medical training still gives minimal attention to nutrition and lifestyle. In urology, the scalpel gets more airtime than the fork. But here's what we now know. A diet high in processed foods, saturated fats, and sugar promotes inflammation. A sedentary lifestyle can lower testosterone and increase visceral fat, which in turn feeds prostate growth. And the foods you eat every single day can either block that growth or accelerate it. So if you've been told it's just age, let me be clear. That's outdated thinking. Yes, age is a factor, but lifestyle is the fuel. And you have more control than you've been told. We're here to change that narrative, and it starts with your plate. Let's break down some of the most powerful foods for prostate health and, more importantly, why they work. Tomatoes, especially cooked. They're packed with lycopene, a red pigment and powerful antioxidant that directly concentrates in your prostate tissue. Studies show lycopene can lower prostate cancer risk and even reduce symptoms of BPH, benign prostatic hyperplasia. The trick? Lycopene works best when tomatoes are cooked, like in sauces or pastes, and paired with healthy fat, like olive oil. That boosts absorption by 2 to 3 times. Cruciferous vegetables, broccoli, cabbage, Brussels sprouts. They contain a compound called sulforaphane. It helps detoxify carcinogens, reduce inflammation, and may even target cancer stem cells. One study showed men who ate these vegetables several times a week had significantly lower prostate cancer rates. Healthy fats, olive oil, avocados, and fatty fish like salmon or sardines. Why fats? Because your hormones, including testosterone, depend on fats to stay in balance. The right fats reduce inflammation, support hormone function, and may even help shrink the fat pad that builds around the prostate with age. Green tea. Rich in catechins, powerful antioxidants that support cell repair and fight inflammation. Green tea has been linked to lower prostate cancer risk and improved urinary flow in men with BPH. Berries, especially blueberries and raspberries. These fight oxidative stress, which plays a huge role in both prostate aging and inflammation. Plus, they're low sugar and high fiber, a win for your hormones and your waistline. Nuts, especially Brazil nuts and walnuts. Brazil nuts provide selenium, a trace mineral tied to lower prostate cancer risk. Walnuts bring in omega-3s and antioxidants. Just don't overdo it. A small handful a day is plenty. So, what's the real secret? These foods don't just fill you up. They feed your cells exactly what they need to fight silent inflammation, balance hormones, and support prostate health from the inside out. This isn't about superfoods or trends. It's about turning your meals into medicine and giving your body the tools to do its job. Let me tell you about one of my patients, John. He's 58, works a desk job, loves steak and rarely thought twice about what he ate. He came in with classic BPH symptoms, waking up 3, sometimes 4 times a night, tired during the day, low energy, constant urgency, and worst of all, feeling like this was just normal aging. We did a basic exam, checked his labs, confirmed an enlarged prostate. We adjusted his meds slightly, but more importantly, we changed what was on his plate. We didn't overhaul his life. No extreme diets. Just a few key changes. Cooked tomatoes 4 times a week, sauces, soups, even homemade chili. Swapped out red meat for grilled salmon or sardines twice a week. Cut out sugary drinks and late-night snacks. And added a small handful of walnuts or Brazil nuts a few days a week. In just 3 weeks, he was sleeping through the night for the first time in years. His urinary flow got stronger. That sense of urgency? Nearly gone. And his words, not mine, "Doc, I feel like myself again." More energy. More clarity. I'm not planning my day around bathroom stops. That's the power of food. It didn't cure him overnight, but it gave his body the support it needed to heal, regulate, and function better naturally. Food isn't a magic pill, but if you think of your meals like medicine, the results can be just as powerful and without the side effects. So if you're tired of symptoms running your life, start where it's simplest, your next meal. So here's your next step. Drop a comment. What's your go-to food for supporting prostate health? Tomatoes? Green tea? Let me know. And if you're ready for the full breakdown of a prostate smart diet, I've got another video lined up right here. Just click and dive in. I'm Dr. Max. Thanks for watching, stay strong, and I'll see you in the next one.